Value Partnerships is a name that was chosen intentionally several years ago to reflect the fact that we're focusing on achieving value in healthcare. That's our central goal. We're very focused on that. Value meaning improving the experience that patients have in their healthcare and improving the quality and the efficiency of that care. So it's affordable and it's reliably of high quality. So that's the main goal. The word partnerships was included with equal importance and emphasis because we realized that this isn't something that any one stakeholder in healthcare could achieve on their own, that it really did require a partnership. So the partnership is between doctors in the blues, between doctors in hospitals, hospitals in the blues, and all of those stakeholders together, as well as other facility-based stakeholders as well, not just hospitals, but eventually home health care and skilled nursing facility and so forth will all have to be engaged in a collaborative partnership to try and optimize value. Care should be organized, it should be proactive, you should know who your patients are and what their needs are, you should actively engage them as partners in the care, you should reach out to them when they don't come in for the services that are essential to them or when they're not taking their medicines. You should support them in between visits to the doctor in meeting the goals that they have established in partnership with the healthcare team. All of this thinking then leads to developing a set of capabilities, which we call medical home capabilities, that assure 24-hour access to some decision maker from the medical home, assure that you have goals set that you as a patient have set in common with your medical team, that someone is coordinating and managing care to help you achieve those goals, supporting you in self-management and taking care of yourself so you do a better job of living a healthy lifestyle and doing the things such as taking medicines or getting exercise or avoiding excess salt that will help, the things that will help you stay healthier and live longer. We now have a critical mass of PCMH or medical home-based practices that allow us to call that the beginning foundation of a truly organized system of care. So to date, we've been trying to create better systems and processes of care within a practice, and now the goal going forward is to knit those practices together in a more close-knit fashion. We call it clinical integration, so that the primary care practices, which serve as the foundation of the organized system of care and the entry point through which patients come to get care and have their needs identified and met, those primary care practices become knitted together through shared information systems and shared processes of care, and then they connect with, partner with specialist practices in the same community of caregivers who also share the same information systems and processes. And then together, they affiliate with and connect up with hospitals in their community of caregivers. And again, sharing the same comprehensive clinical information systems and processes of care so that by the time all those linkages are established, when a patient has to, with a chronic need, has to come into the system of care through the primary care office, the medical home, and sees a specialist, the specialist knows everything that's happened, knows all the tests and the test results, doesn't have to repeat them, doesn't have to guess what it is that's needed. When the patient has to go to the hospital for an emergency department service or to be admitted, everybody in the caregiving system within the facility also has that same information. Importantly, by way of example, then in an effective organized system of care, you might have a patient with diabetes who, in the future state where things really work well together and there's good clinical integration, the patient might get sick, get a little unstable, have to go to the emergency department, but the emergency doctor who has knowledge about on the same system, who's the primary care doctor, who's the specialist, when were they last seen, what tests were done, and knows that the patient can get back to those offices on a timely basis, has full confidence, may well be able to discharge the patient not from the emergency department to the floor in the hospital, but the emergency department to home with full confidence that the patient won't fall through the cracks because of this organized system of care.